Do you know which deformity presents as a hard lump on the back of the heel? The answer is Haglund's deformity. Haglund's deformity is a bony prominence that forms at the Achilles tendon insertion onto the calcaneus bone. The patient may present with the following symptoms: a palpable lump on the back of the heel, skin discoloration in the area of the lump, heel pain, and posterior ankle swelling. On ultrasound, the lump will appear as multiple growths of bone that extend outwards from the surface of the posterosuperior aspect of the calcaneus. These are called exostosis. The Achilles tendon should be scanned at the insertion onto the calcaneus where the palpable lump is. At this level, you want to scan it in the long axis from medial to lateral, and then you still want to follow the normal Achilles protocol where you scan it in the long axis from distal to proximal. Then you would turn 90 degrees, and then you would scan the Achilles tendon in the short axis from distal to proximal, focusing on the area where the palpable lump is at the Achilles insertion. Power Dopplers should also be utilized to document any hyperemia present within the tendon or the surrounding bursae. Associated ultrasound findings may include an underlying calcaneal spur, Achilles tendinosis. As you can see in this example, tendinosis is going to appear as hypoechoic thickening of the tendon. Any AP measurement in the long or short axis greater than 5 millimeters or 0.5 centimeters is considered tendinosis. Tendon tears can also exist in conjunction with or separately from tendinosis. These are going to appear as focal defects inside the tendon where there's no substance of the tendon in the area of the tear. Tendon tears can be considered partial or full thickness and should be measured in the long and short axis and the distance from the calcaneus. Bursitis may also be present with this condition and may be located in the overlying superficial calcaneal bursa, like in this example, or in the retrocalcaneal bursa, which is superior to the calcaneus. The bursa will only be visualized on ultrasound when there's fluid present. I hope next time you get a patient with these clinical indications and ultrasound findings, it will be much easier for you to recognize this deformity.